Imagine a day like any other day. You're sitting at work, and all of a sudden you receive a phone call from your spouse saying that your child is very sick and they're on their way into the emergency room for treatment. Upon arrival, your child's blood glucose level is 981. Now, normal levels are 70 to 110. Your child is so sick that they are almost in a coma, and the physician there is deciding on whether or not they need to be care flighted to another larger facility for treatment. To those who can't imagine this happening to them or their family, this is exactly what happened to me and my family in October of 2009. My daughter was diagnosed with type 1 or juvenile diabetes. I am the parent of a child with type 1. I set alarms for 2 in the morning to get up to tiptoe across the house to check blood sugars to make sure that they haven't dropped too low in the middle of the night. I'm also a registered nurse, so I've seen the technical side and the treatment side, but as a parent, I've seen the emotional tolls that it can pull down on you. Type 1 diabetes is a devastating disease that affects thousands of children every year. As complicated as the disease process sounds, it can be made less intimidating because knowledge is power. Today I would like to talk with you about the various treatments for type 1 diabetes that include teaching, monitoring of blood glucose levels, and insulin delivery methods. So you may be asking, well, how does teaching help with a treatment, help with treating a disease? Well, teaching is an effective part of treating type 1 for many reasons. The more you know about the disease process, the easier it is to understand the treatment. According to the American Diabetes Association, type 1 diabetes is a metabolic disease usually diagnosed in children where the pancreas does not produce the hormone insulin. Therefore, the only treatment for type 1 diabetes is insulin. Now, there are differences between type 1 diabetes and type 2 diabetes. The biggest being with type 2, the body does produce some insulin, so pills and oral medications are available to be able to take orally that will help the body use what insulin the body produces. Again, with type 1, no insulin is produced by the body, so insulin has to be given via injection. Ongoing teaching of older diagnosed patients is also very beneficial because it keeps them up to date on new technologies that are available or that are coming out. And it also reiterates and reteaches what they've learned in the past. I would like to next discuss with you why it's so important to closely monitor blood glucose levels. According to research from the American Diabetes Association, close monitoring of blood glucose levels helps to avoid certain diabetic-related health problems such as diseases of the eyes, kidney, and nerves. In a study conducted by the Diabetes Control and Complication Panel, they found that those who followed a very strict intensive control of blood glucose levels had less diabetic-related complications than those who did not. So another very important thing for glucose monitoring is making sure that you've got a sick day management prepared. Stress hormones, when you're sick, are released and they can make the insulin that you're taking for your diabetes less effective. So you may have to check blood sugars more often or give yourself different doses of insulin throughout the day. Another very important part of close blood glucose monitoring is honestly reporting your blood sugars, whether they're high or low. In a study from the Journal of Diabetes and Metabolic Disorders, they found that the major misreporting factor of children were them facing negative consequences. In other words, they were scared they would get in trouble if their blood sugars were high. But it's extremely important, whether they're high or low, to report those to your doctor so that changes in your treatment plan can be made. Lastly, I would like to explore the different types of insulin delivery methods that are available. There are several different options for insulin delivery. Most common is daily injection with a fast-acting insulin using an insulin syringe. This requires multiple injections a day anytime the child eats, has a snack, has high blood sugars, and it requires a second type of insulin at bedtime to keep blood sugar levels steady during the night. The type my daughter uses is an insulin pump. This is the one that we prefer. It requires 1 stick every 3 days to a site usually on the abdomen. Insulin is then delivered via a little small pager-like device that she clips on her belt. Insulin is delivered 24/7, day and night, which eliminates the need for the second type of insulin at bedtime. According to research done by Jessica Valenzuela and her colleagues, the Quality of Life research team found that either style, either injections or insulin pump, were both effective, and there were no life-changing complications or life-altering things that happened when the child was using either or, as long as they were using them effectively. Now, there's no cure for type 1 diabetes that we know of yet, but there is a foundation that is helping to develop new research and study. It's the Juvenile Diabetes Research Foundation, and they are dedicated to finding a cure for type 1. Some of the new therapies that they are working on include insulin cell restoration, beta cell transplants, and mechanical artificial pancreases. And as I mentioned above, there are several different insulin delivery methods, but what is chosen kind of depends on the patient and their doctor. Well, years ago, type 1 diabetes was a death sentence. Though we still don't have a much firmer grasp on what causes it, we do know how to treat it more effectively. Many of you here may know someone whose life has been affected by type 1 diabetes and not realized the day-to-day struggle of combating high blood glucose levels and giving numerous insulin injections. But in our family, we don't let our daughter's diagnosis bring us down, and she certainly doesn't let it bring her down. A good friend of mine told me right after she was diagnosed, "You know, Jen, they shouldn't call it diabetes. They should call it live-abetes instead." Thank you.